Briefly, before both you and I, the chart, or I should say graphic that's before both of us, poses the question: does Curcuma longa, otherwise known as turmeric, basically help alleviate pain in reference to osteoarthritis of the knee with Effusion-Synovitis? That is the question. Now, obviously, if you're looking at the graphic, it pretty much answers the question that's posed at the very top. But the graphic is important because the main aspect of the graphic, there's one part of it, I should say, the 1,000 milligrams a day of turmeric. It's not mentioned in the abstract or the published study. So this gives you the doses utilized over the 12-week study, which obviously answers the question in reference to, yes, at least according to the study, it modestly helps relieve osteoarthritis knee pain. But to proceed with the study as follows. And keep in mind, the DOI citation, everything there will be linked so you can see the graphic later on your own too, just in case you forget. But to proceed, turmeric supplement more effective than placebo for osteoarthritis knee pain. An extract of Curcuma longa, commonly known as turmeric, was found to be more effective than placebo for reducing knee pain in patients with knee osteoarthritis. However, Curcuma longa did not affect structural aspects of the osteoarthritis knee, such as swelling or cartilage composition utilizing MRI. Keep in mind, the study was only 12 weeks. Findings from a randomized double-blind placebo-controlled study are published in the Annals of Internal Medicine. To proceed with the research detail, and this is where that dosage is going to be real important because it doesn't mention the dosage in the abstract, just how often they took it. Research from the University of Tasmania, Australia, randomly assigned 70 participants, which makes it a relatively small study comparatively, with symptomatic knee osteoarthritis and ultrasound evidence of effusion, swelling inside the knee joint, for those that were about to ask that question, to receive either 2 capsules per day, so each capsule would be about 500 milligrams, of Curcuma longa or matched placebo for 12 weeks to determine the efficacy of turmeric for reducing knee symptoms and joint swelling. Changes in pain and the Effusion-Synovitis volume were assessed by a standardized questionnaire, respectively, over 12 weeks. So the patients don't know who has the turmeric and who does not, which alleviate basically, which makes it randomized, even though not necessarily double blind, but at least randomized. But to proceed, the researchers also looked for changes in cartilage composition, pain medication usage, quality of life, physical performance measures, and adverse effects. Adverse events. Effects, one and the same. After 12 weeks, they found that patients taking the turmeric supplements reported less pain than those in the placebo group. Remember, each group doesn't know who's taking the turmeric or who is not. They also consumed fewer medications compared to the participants in the placebo group. Now, that's a victory in its own, because often pain medications, especially taken long-term, tend to accumulate quite a high level of adverse events, or now I'm using events, adverse effects, side effects, so on and so forth. So the turmeric really made a good complement in reference to basically the pain medications that patients were utilizing in this particular study itself. But to proceed with the caveat, due to the modest effect of turmeric extract on knee pain, small sample size of the study, short duration of the follow-up, and a single research center, the researchers suggest that multi-center trials with larger sample sizes and long duration of follow-up are needed to assess the clinical significance of their findings. Every researcher always enjoys having a larger sample group to basically increase the confidence in reference to the outcome, so they could say with definitive confidence, yes, turmeric does help reduce pain in reference to osteoarthritis of the knee, which is actually a noble thing. Now, to proceed as follows, the DOI link, as always, on the YouTube site will be straight to the study itself. If you need to see the visual graph, now keep in mind it's a little tricky, you have to click on the visual button, and that'll open up the graph, which of course will yield you the daily dosage of the turmeric itself. Also, too, as a side note, I'm not doing data analytics in regard to pandemic mitigation today. So for those that want to follow the data analysis in reference to looking from Johns Hopkins and Oxford University, so they could actually see real data in reference to the successes and failures of pandemic mitigation, that I'm doing on Saturday and Sunday night. So that door is open to all of you to discuss, criticize, evolve your thought process in reference to the pandemic, so on and so forth. But to proceed as follows, back to the study. Link will be there on YouTube. I greatly, greatly, greatly hope, well, that was loud. I hope you find good use of this information itself. The dosage, obviously, we discussed as well. Anything that's going to help take an individual out of pain, especially if there's no adverse events to the effect, is definitely, definitely, definitely a noble venue in which to research on its own. Again, we're off Twitch channel signing off. Gratitude. Saturday or Sunday, the data analytics in reference to pandemic medication utilize Python style. Outside of that, so keep that in mind for those who want to visit later on. But thank you. Gratitude, as always. And if you don't see it, stop by on Saturday and Sunday. I look forward to seeing you all once again on Tuesday or 7 days from now. Catch you all next time. Bye.